Hello, I am Dr. Vineeta Singh Tandon, Consultant Internal Medicine, PSRI Hospital. Today we are going to talk about monkeypox. Monkeypox is a viral disease which is caused because of monkeypox virus, and this disease comes in humans from the animals through consumption of contaminated food products like meat, or when we come in contact with their body secretions and fluids or their skin surfaces. This can also spread from one person to another person when we come in contact with the secretions and the body fluids of an infected individual, or when we share the contaminated objects like bed sharing with the same person. This disease is generally self-limited. The incubation period is around 6 to 14 days, and the symptoms of this disease will spontaneously resolve in the next 4 to 6 weeks. Symptoms are similar to that of viral illness. Any other viral illness like high-grade fever, body ache, headache, rashes which are more pronounced on your face and your extremities. The distinctive feature here is the presence of lymphadenopathy, which is not seen in cases of smallpox and chickenpox. As I said, it's a mild disease, but in some cases, in rare cases, it may develop severe complications also, especially in those individuals who have low immunity, who are immunocompromised, like diabetes, kidney transplant patients, HIV patients, or people who spend prolonged period in contact with infected individuals, like healthcare workers or the laboratory staff who are involved in transporting the samples of these infected patients. As I said, that this is a self-limiting disease and it may develop some complications. The complications include development of infection, sepsis, your lung infections like pneumonia. You may have brain infections like encephalitis. Eyes may also get affected, which may lead to damaging your cornea and then loss of vision. It is believed, and as per WHO also, that people who were previously vaccinated with smallpox carry 85% protection against monkeypox. If we talk about how do we diagnose it, then PCR is the gold standard for diagnosing this disease. PCR of the blood or serological tests are not recommended. PCR of the samples taken from the skin lesions are considered to be good samples. Skin biopsy, if feasible, can also be taken. How do we treat it? Treatments generally does not involve antibiotics or specific antivirals. It is a supportive treatment that we give, that is maintaining the hydration, the nutrition of the patient, maintaining electrolyte balance, and adequate rest. In severe cases where complications develop, those complications have to be taken care of. Now, besides all that, what is more important is the preventive strategy, that is being aware of the risk involved and also to reduce the transmission of this disease. So this we can do in two ways. One is reducing the transmission from animal to human. So when we consume any food of animal origin, it should not be raw, it should be well cooked. And while taking care of your pets, hygienic measures should be followed. Second, reducing the transmission from one person to another. If you develop symptoms, self-isolate yourself. Secondly, wearing mask, hand washing, keeping distance from one another, and cough etiquette. These are simple measures which we were following in COVID time also, and we should be following now also to prevent the spread of this disease. Thank you.